Pause. Shifa. Maternity care, most affordable and compassionate, maternal health care in city of Vijaypur.
Hello and welcome. Today we are diving into one of the biggest journeys of life, childbirth. We're going to walk through everything you can expect for both a normal delivery and a C-section, using some fantastic insights from Dr. Salma Attar. Ready? Let's get into it. Dr. Attar really hits the nail on the head with this, doesn't she? That feeling, a wild mix of being incredibly excited and, yeah, pretty nervous. It is so normal. And hopefully, by the end of this, we can turn a lot of that nervousness into pure confidence.
So, here it is, the big question on so many minds. It can kind of feel like you're standing at a fork in the road, wondering which way you're going to go. So, let's actually explore both of those paths, so you know what they look like.
But before we go any further, let's get one thing straight. This right here is the absolute most important thing. The number one goal always is a healthy mom and a healthy baby. That's the destination, no matter which route you take to get there.
All right, let's start with path one. We're talking about normal labor, the way our bodies are naturally built for this whole process.
So what is it? Simply put, it's the natural way of giving birth. And I absolutely love that last line, that little reminder, your body is designed for this. That's such a powerful and reassuring thought to just hold on to.
So how do you even know it's starting? Well, your body gives you some pretty clear signals. Think of these 3 signs as your body's way of saying, okay, it's go time. If you start feeling those contractions getting stronger and closer together, that's your cue to call the doctor and head to the hospital.
And once you're at the hospital, the whole thing happens in about 3 stages. Stage 1 is the marathon, not the sprint. That's when your body is slowly and steadily doing its thing. Stage 2, well, that's the big moment, the final push to meet your baby. And stage 3 is just wrapping things up, delivering the placenta.
And the upsides of a normal delivery? They're pretty significant. We're talking a faster recovery, you get to avoid major surgery, and you'll probably have a shorter hospital stay, which just means getting home to settle in with your new little one even sooner.
Okay, now for the second path. It's so important to see a C-section not as a failure or a detour, but as a necessary and sometimes life-saving helping hand when it's needed.
So, what is it exactly? A C-section, or Caesarean, is a surgery where the doctor delivers the baby through a small cut in the lower abdomen. It's just a different route to get to that same beautiful destination. And why might that helping hand be necessary? Well, it's never a random choice. There are very specific medical reasons, and they all boil down to keeping you and your baby safe. Maybe the baby's in a tricky position, or maybe they're just getting too tired. In those cases, a C-section is simply the safest way forward.
Now, I know the idea of surgery can be nerve-wracking, but this is a really important point. Thanks to modern medicine, you are awake for the birth. You get to hear your baby's first cry, you are present for that moment, all while being completely pain-free from the waist down. It's pretty amazing.
So, whether it's path 1 or path 2, the place where you give birth matters a lot. Let's talk about the hospital safety net and what that really means for you.
This number, it's so simple, but it means everything. 24/7. Babies don't exactly stick to a 9-to-5 schedule, and neither does your medical team. It means that no matter what time it is, day or night, if something unexpected happens, help is right there. And that help is more than just one person. It's a whole system. It means having an advanced ICU right there so any serious issues can be handled immediately, without the stress of being moved. And for your baby, it means having expert neonatal care ready to step in if they need a little extra support right after birth. It's truly a complete circle of care.
All right, the baby is here. It's the most amazing moment. So what happens next? Let's talk about recovery, because knowing what to expect afterwards is just as important as knowing what to expect during.
This chart breaks it down so clearly. With a normal delivery, you'll probably be up and walking around within a few hours. After a C-section, it's a bit more gradual. Same with food, you get back to a normal diet quicker after a normal delivery. And of course, you can see the difference in hospital stays. It just helps to set some realistic expectations.
Okay, we've gone over the paths, the recovery, the safety net. Now for the final piece of the puzzle, you. How can you prepare yourself for the big day?
And this is just fantastic practical advice from Dr. Attar. First, pack that hospital bag early, like by the 8th month, just to get it out of the way. Second, try not to fear the pain. Focus on breathing, and remember there are options to help you manage it. And maybe the most important things, trust your team, but also speak up. If you don't understand something, ask. You are an active part of this whole process.
You know, this quote just brings it all home. Every single birth story is different. It's going to have its own twists and turns, its own unique moments, but in the end, the destination is exactly the same for everyone, holding that little miracle in your arms.
So, at the end of the day, it's not about which path you take. It's about feeling prepared, feeling supported by a team you trust, and feeling informed. Because when you have those things, you are absolutely ready for the incredible journey ahead.
Shifa Maternity Care Dr. Salma Attar for appointment call 243761.